Hi everyone, welcome to CAPSA. Today we will learn about barbiturates, pharmacology of barbiturates. So today's topic is barbiturates. Now, what are barbiturates? So barbiturates are the category of sedative-hypnotic drugs which induces sleep, that is called as barbiturate-induced sleeps. So these are kind of sedative hypnotic drugs causes barbiturate-induced sleep. Why I named as barbiturate-induced sleeps? Because these kind of sleeps obviously differs from physiological sleeps. Because barbiturate-induced sleep, barbiturate causes reduced in the REM sleep and also reduces the stage 3 and 4 type of stage, the duration of or the time. Okay. Now, what are the classification of barbiturates? Classification mainly based on the duration of action. Okay. So based on the duration of action, barbiturates are classified as 4 categories. First one is ultra short acting barbiturates. In ultra short acting barbiturates, the drugs comes under this category are Methohexital and Thiopental. And the second category is short acting barbiturates. And in this category, the drugs are Pentobarbital and Secobarbital. The third category is intermediate acting barbiturates. In this category, the drugs are Amobarbital and Butabarbital. The fourth category or the last category is longer acting. In this category, the drugs are Phenobarbital and Primidone or Primidone, whatever your spelling is. The next is, what is the mechanism of action, also known as MOA, of barbiturates? So barbiturates mainly act on GABA-A subtype of receptor. What is causes? Barbiturate causes post-synaptic enhancement of GABA receptor. As a result, by interacting with alpha-beta subunits of this receptor, increases the chlorine ion influx, which causes post-synaptic hyperpolarization, as a result CNS depression. So what barbiturates causes? Barbiturates binds with the alpha-beta subunit of GABA-A receptor. As a result, it increases the duration of chlorine ion channel opening, which causes increased influx of chlorine ion, which then causes post-synaptic hyperpolarization of membrane. As a result, CNS depression. Now, what are the pharmacokinetic parameters of important drugs? PK parameters. First drug is Thiopental, which comes under the category. Which category you have studied previous? That is ultra short acting drug. Okay. Thiopental actually given through IV infusion route. Okay. Because it is highly lipid soluble, it shows high apparent volume of distribution, high VD, and extensively metabolized in the liver. Extensively metabolized in liver and eliminated via kidney. With the elimination half-life of 3 to 26 hours. The second drug is, which comes under the category of short-acting barbiturates, that is Pentobarbital. So Pentobarbital is given through the oral, IV and rectal route. It shows extensive tissue binding, metabolized in the liver via oxidation process and produces metabolite like hydroxypentolate, Barbital. It is an inactive metabolite excreted unchanged via urine. The next drug is Amobarbital. Comes under the category of intermediate acting barbiturates. Amobarbital given through oral or IV route. And it shows volume of distribution near about 0.9 to 1.4 liter per kg and near about 59% plasma protein bound. Metabolized completely in the liver. And excreted through the urine. The next last drug is Primidone. That is comes under long acting barbiturates. So these drugs absorb through mainly oral route and shows near about more than 90% absorption. Volume of distribution or apparent volume of distribution is 0.6 to 0.75 liter per kg. Found in breast milk, obviously contraindicated in pregnancy, metabolized in liver, and produces metabolite like Phenobarbital and phenyl ethyl malonamide, eliminated via urine near about 15 to 65% drug excreted unchanged. Okay. Now, what are the adverse effects? The main two adverse effects are hypotension and respiratory depression. Others are headache, drowsiness, tolerance, dependence, and megaloblastic anemia. If we use for longer period of time. This kind of drug shows tolerance and dependence. Obviously, if the drug shows tolerance and dependence, it causes poisoning. So, barbiturate poisoning is the important topic. When the barbiturates taken in higher dose, it causes poisoning. And this poisoning can be treated in several ways, like maintain breathing, maintenance of electrolyte balance, or it can be gastric lavage, hemodialysis, and alkaline diuresis. This is the main treatment which is used in barbiturate poisoning. Because barbiturates are alkaline drug, so urine is alkalinized by using sodium bicarbonate to excrete out more drug. Okay, because we have studied previously the condition acidic drug excreted in the acidic environment, basic drug excreted more in the basic environment. So, if the urine become alkalinized, then barbiturate basic drug obviously excreted faster. Now, what are the drug interactions? Barbiturates mainly interact with oral contraceptives, oral anticoagulants, and oral hypoglycemics. Now, what are the indications or clinical use? ultra short acting barbiturates like Methohexital, Thiopental actually used for the induction and short term maintenance of anesthesia. So these kind of drug mainly used for the induction and short term maintenance of anesthesia. Short acting like Pentobarbital, Secobarbital, intermediate acting like Amobarbital, Butabarbital are used in the treatment of insomnia and preoperative medications. As a preoperative medications, okay. Long-term barbiturates like Phenobarbital, Primidone, they are used in the treatment of seizure. Mainly in the treatment of status epilepticus. So this is the end of my lecture. If you like my video, please do like, comment and subscribe, and obviously share with your friends. More you like, more it will be helpful to me for creating more videos for your exam purpose. Okay. Thank you for your attention.